All right, good afternoon. I want to start by echoing the governor's sentiments and thank everyone throughout the state who's had a hand in getting us to that 1 million dose administered milestone this week. It's an incredible feat, something that we should all be extremely proud of, but we still have work to do. So I'll be brief, but on the operations side, we have many new efforts that are either planned or in place to get to that uncertain population that Dr. Alexander Scott had spoken about. For example, this week, and we'd shared last week, we've begun our outbound calling campaign to those Rhode Islanders 75 plus to help coordinate an in-home vaccination opportunity or connect them with one of our administration partners, either at a mass vaccination site or something more local. And through that program, which has only been running just about a week, we've already vaccinated about 95 Rhode Islanders. In addition, people who are 75 and older who have not been vaccinated yet, or if you have a loved one or know someone that falls into that category, you can call us to take advantage of this at-home vaccination program. To schedule an appointment, call 211 or visit the website covid.ri.gov/vaccination, and you can find the number for the ambulance company specific to your community that can come provide that at-home vaccination. In terms of schools, RIDO and RIDE are working with all districts to ensure that vaccination events occur for students 12 and older by the end of this month. Prior to the authorization of the Pfizer vaccine for 12 to 15-year-olds, 59 clinics were scheduled in 45 schools to serve our 16 to 18-year-old population. Now that we have the 12 to 15-year-olds approved for Pfizer, additional clinics are being planned for this new pediatric population. While all of this planning happens with schools, we continue to have no appointment opportunities for parents and guardians who want to bring their 12 to 15-year-olds to get vaccinated. So remember, only the Pfizer vaccine is approved for this population. So we have Pfizer vaccine readily available for no appointment vaccinations at the Dunk, at Middletown, and at Sockanosset Crossroad. Of course, you can always schedule an appointment so that you know that you have that Pfizer vaccine available at either one of the mass vaccination sites, our regional municipal sites, or many of our other partners in 200 clinics across the state, much like we did in the McCarthy household this week. Made an appointment on Tuesday night. Both of my daughters received their first dose on Wednesday morning, and a huge thank you and shout out to the Rhode Island National Guard team at Sockanosset, who after administering well over 100,000 shots, still does it with a smile on their face, and actually got a couple of laughs out of my daughters, which is no easy feat. So this expansion to 12 to 15 was exciting this week, and it's a part of our overall strategy for this next phase, where we're fundamentally putting vaccines in the path of Rhode Islanders. And we're reaching out and providing clinics and opportunities at high traffic settings across the state. So as I've shared in the past, we're partnering with businesses to have worksite clinics. We're going to be in state parks and at beaches this spring and throughout the summer. We've held clinics at recovery centers like Anchor and Kodak. And we've already started vaccinating employees and shoppers at businesses and grocery stores around the state, and we'll be at transportation hubs in line with what the governor shared earlier around removing the residency requirement like TF Green closer to the end of the month. So we are going to be where Rhode Islanders are over the next few weeks and the next few months until every eligible Rhode Islander has had every opportunity to get their shot. So with that, I'd like to invite Dr. Holland up to the mic to say a few words.
Good afternoon. As you've heard, earlier this week, the FDA authorized the Pfizer COVID-19 vaccine for use in children ages 12 to 15. Pediatricians around the country celebrated this decision, and the American Academy of Pediatrics and the CDC have recommended that this age group receive the Pfizer vaccine. Today, I would like to share with you how the Pfizer vaccine was studied in children 12 to 15 and why I'm recommending it to everyone that's eligible. First, I'll explain a little of how the Pfizer COVID-19 vaccine works, followed by the clinical trial and why it's critical that parents and caregivers consider vaccinating their eligible children. The Pfizer COVID-19 vaccine is a messenger RNA or mRNA vaccine. These vaccines work by teaching our cells how to make a protein, and that protein creates an immune response that gives us protection without ever having to risk the consequences of getting sick with COVID-19. More specifically, the Pfizer vaccine contains a tiny piece of genetic material. That's the mRNA. That tiny piece of material teaches our body how to make the spike protein, which is found on the outside of the virus that causes COVID-19. This spike protein is completely harmless. In fact, it's extremely helpful because it's what our body recognizes and helps to create our immune response or our protection against COVID. Just like what happens with a natural infection. It's important to know that mRNA vaccines do not cause COVID-19. In fact, they don't interfere with our DNA or genetic makeup in any way, and there's no evidence that they impact or cause any issues with fertility or difficulty getting pregnant. These are just a few of the concerns I've heard from people since the start of the pandemic and the availability of having COVID-19 vaccine. The Pfizer vaccine was rigorously studied in a clinical trial that included more than 2,200 teenagers from the ages of 12 to 15. Of those more than 2,200, about half of them received vaccine and half received a placebo or no vaccine. There were no cases of COVID-19 in the children who received the Pfizer vaccine. There were 16 cases in those that did not receive the vaccine, and what that means, and what's really important to know, is that this is 100% vaccine efficacy. It's also important to know that the immune response that's generated in 12 to 15-year-olds is even better, more robust than that in older age groups, especially in those 16 to 25. Children in the study experienced similar post-vaccine symptoms, the same ones that we've seen in older teens and adults. The most common symptoms seen in the teenagers in the study were pain at the injection site, fatigue, headache, chills, muscle pain, fever, and joint pain. It's important to know that these symptoms are normal and consistent with those experienced by older age groups. There were no deaths reported in the clinical trial and no reports of blood clots, serious allergic reactions, or Bell's palsy. All of the participants, or all of the teenagers in that clinical trial, will continue to be monitored for long-term protection and safety for an additional 2 years after their second dose. Given this rigorous review process, the results showing a vaccine efficacy of 100%, and the knowledge that we've given more than millions of doses to older teens and adults, I feel comfortable and confident, along with other pediatricians across the country, in knowing that the Pfizer vaccine is both safe and effective for children 12 to 15 years of age. At the start of this pandemic, children represented a very small percentage of the cases of COVID-19. Now, both in Rhode Island and nationally, we're seeing a rise in the number of cases of children. As a parent, I've seen firsthand how tough the pandemic has been on our children. As a pediatrician, I can tell you more than 1.5 million adolescents aged 12 to 17 have had COVID-19, and more than 13,000 have been hospitalized with severe disease. As a pediatrician who specializes in infectious disease, I have seen kids hospitalized with severe COVID, and I've seen those that had no symptoms or very mild symptoms, and then later develop an inflammatory condition called MIS-C and have required stays in our pediatric intensive care unit. COVID-19 has also taken a considerable toll on the mental health and emotional well-being of our children. It's impacted their social well-being and their educational experience. Vaccination is key to protecting children both in school and outside of school. Vaccination is critical for our children to safely go to camp, to safely play sports, and to be able to get back to interacting with their family and their friends. Again, as a pediatrician and as a parent, I look forward to the time when I'm able to vaccinate my children, and I'm thrilled that more of my patients can now be vaccinated. If your child is eligible, please consider getting them vaccinated. And now I'll turn it over to Dr. Lamont. Thank you.
Thank you very much, Governor. Thank you very much, Commissioner. I'm a pediatrician, and one of the most important things that we do is to vaccinate children. I am one of the older folks here, and I have some gray hairs, and I go back. And when I first started practice, I saw lots of kids die from diseases that we now prevent with vaccines. It seems unthinkable to think about a 3 or a 4-year-old or an 11-year-old going to their funeral. But that's something that I experienced early in my career because we didn't have vaccines for many of the diseases that we now have vaccines for. Because of the efforts of the health department, we now have vaccines available to children throughout the state, and we have one of the highest vaccine rates in the country, and most young pediatricians will not see any of these diseases that I saw children die from early in my career. Speaking about the COVID vaccine, I was a participant in the first Pfizer study. In fact, I may have been one of the first people in the state to be vaccinated. I looked back and I got my vaccine on August 10th. And other than some arm pain and maybe a little bit of fatigue after the second vaccine, the vaccine worked very well. I didn't find out I'd received it until December, and I had blood work done recently when I donated blood and found out that my levels are sky high. So at least for one person, this is a very effective vaccine. I have been involved in the Moderna trials, which is another vaccine that's approved for adults and will soon be approved for adolescents. In fact, we're starting a study looking at children as young as 6 months of age to vaccinate them, although that has not started yet. One of the things you find out in the 300 people we had vaccinated here in Rhode Island is that the side effects from these vaccines are very, very minimal for adolescents. A few sore arms, a couple of swollen lymph nodes. And the most important thing is that as an investigator, I am informed about problems that happen throughout the country. So if somebody falls off a bike and breaks their leg, I'm going to get an email about that. And just nothing happened during the trial so far. And once again, these are very, very safe vaccines. I don't know about all of you, but I'm getting tired of wearing a mask. I'd like to be able to hug a friend when I see them. I have friends whose kids are getting married. I'd like to get back to their weddings, and I'd like to see a Broadway show sometime. The best way to do it is to vaccinate your kids, vaccinate yourself, and hopefully in the future, vaccinate your younger children.